There's been over a 20-to-1 return.
If you had put that money into an S&P 500 and reinvested the dividends, you'd come up with something like $17 billion, but you think it's $200 billion.
Here, yeah.
You're okay. You're not going to get COVID if you have these vaccinations.
These vaccines are highly, highly effective.
Vaccinated people do not carry the virus, don't get sick.
They're really, really good against variants.
Everyone who takes the vaccine is not just protecting themselves, but reducing their transmission to other people and allowing society to get back to normal.
Get your first shot, and when you're due for your second, get your second shot.
Our key goal is to stop the transmission, to get the immunity levels up so that you get almost no infection going on whatsoever.
When people are vaccinated, they can feel safe that they are not going to get infected.
If you're vaccinated, you're not going to be hospitalized, you're not going to be in an ICU unit, and you're not going to die. If you are fully vaccinated, you no longer need to wear a mask.
Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing.
But what they can't do anymore is prevent transmission.
We didn't have vaccines that block transmission. We got vaccines that help you with your health, but they only slightly reduce the transmissions. We need a new way of doing the vaccine.
The level of virus in the nasopharynx of a person who's vaccinated and infected is the same level as the level of virus in the nasopharynx of an unvaccinated person.
Reports from our international colleagues, including Israel, suggest increased risk of severe disease amongst those vaccinated early.
And if you look at Israel, which has always been a month to a month and a half ahead of us, they are seeing a waning of immunity, not only against infection, but against hospitalizations and to some extent death. A booster might actually be an essential part of the primary regimen that people should have.
The plan is for every adult to get a booster shot.
It's clearly one of the best investments I've ever been involved in.
Now on the vaccine, and just in terms of, I think I heard you say something elsewhere about maybe needing multiple vaccinations, that it wouldn't just be like a one-time vaccination. Can you just explain how you see this?
Okay, none of the candidates that we have much data on look like they'll work with a single dose. So these are all multi-dose vaccines. And as we really look at the effectiveness in the elderly, some of the constructs may require even more than 2 doses to get the kind of protection we want. None of the vaccines at this point appear like they'll work with a single dose. That was the hope at the very beginning. Maybe one of them, particularly in the second generation, won't surprise us. We hope just 2, although in the elderly, sometimes it takes more. And so making sure we have lots of elderly people in the trial will give us that data.
We had perhaps too little caution and too much optimism for some good things that came our way. I really do. I think all of us wanted this to be done. Nobody said waning when oh, this vaccine's going to work. Oh, well, maybe it'll work, it'll wear off. Nobody said, well, what if the next variant doesn't, it's not as potent against the next variant.